Hello and welcome. The Evolving Mind. And we are talking about healthy and unhealthy relationship with Dr. Mitra. Welcome to program.
Hello, good afternoon.
Good evening.
How are you?
I'm good, thank you. How are you?
I'm very well, thanks for asking.
So, we are going to continue and talking about healthy and unhealthy relationship, huh? So,
Absolutely.
do you like to review one more time what does it mean in the short, sentence or short, like a 30 minutes? It's not 30 minutes, sorry, 30 seconds. If you want to go 30 minutes just with this one, then so what's the definition of healthy and unhealthy relationship?
Basically, we have to know that what is the elements of the healthy relationship. When you do have the healthy relationship, you do have enough, room and space for the growth. You do have enough good feeling. You do have the expansion of your spirit. And basically, the healthy relationship is based on the effective communication, based on the trust, based on the level of the care and security. And on the top, we have the roof, which is the love.
Okay, and what about the unhealthy relationship?
Unhealthy relationship is kind of restricting you, just trying to limiting you. If you do have enough access to your your network, social network, other friends, unhealthy relationship cause the restriction, limiting you, and decreasing the level of the interaction that you do have with the other friends or your social networks. Unhealthy relationships comes with the jealousy, comes with the threat, comes with ignorance, ineffective relationship, comes with the ineffective communication.
Okay, and so last time you started talking about we should educate ourselves, right? So
Absolutely.
do you like to continue with that one, or we want to find out how we can have a healthy relationship, or do you like to go in this way?
Sure, why not? So I believe that when you need something, you are looking for a role model. You are looking
Mm-hmm.
for outside as a role model to find out what is the healthy one that you are looking for. That, and I believe that we don't have a role model for healthy relationship. We don't have a objective model that we can look at it and say that, oh, okay, this is the characteristic of a healthy relationship and I should follow it. So I believe that we should do the prevention and education. By education, I mean that early intervention with the teenage, especially when they are in the critical emotional and hormonal imbalances. This is a very good time that they will understand that what is their relationship, what is the healthy relationship, what is their needs from that relationship, and what is their expectation for that relationship. So yes, I believe that we have to have the education, especially our young population, to decrease the level of the anxiety, to decrease the outcome of the depression, and involving with the drugs, drop off out of school, pregnancy, unwanted pregnancy, and all of this stuff. Yes, the best way is the prevention and education.
Okay, and I remember last time you mentioned about something is between associate between brain and relationship or mind and relationship. Am I correct?
That's right. Absolutely, you're right.
Okay, what's the definition of brain?
All right, cool. Actually, when we are talking about the brain, your mind's going through some kind of cells with the synapses and projection from that type of the cells. So yes, neurons are the major and the most important component of the brain. And these neurons supported by the group of the cells, we call it as a glial cell. So it's a connection of the cells together that we call it as a brain. So this is the physical material that we can see, we can touch, we can do the operation, and we can do a lot of researches on the brain. But about the mind, if you ask me that, what is the mind? To be honest with you,
what's the definition of mind here? Is it different?
Yes. Oh, absolutely. They are different.
Okay.
And if you ask me,
I know it's different, but I'm acting looks like I don't know. Okay. But I'm not a good actor. But anyhow.
That's a good one. Yes, they are different, actually. There is no literature to exactly tell you that what is the mind. If I want to tell you that, is it the function of the neural cell, is that mind? Or if I'm going to ask you that, maybe is the relative connection between the neurons is mind. Well, to be honest with you, no one has a definitive definition about the mind. But I want to tell you that, when we, stimulate a neuron, we trying to make changes from the electrical pulses to chemical pulses. What does it mean? We do have an electron ion, sodium and potassium, which, transfer to a neurotransmitter. So I'm talking about the electrical charges change to or turn on to the chemical charges. But when we are talking about the mind, means that something regulate these changes, something that modifying these, changes. And do you believe that, it's just located in mesolimbic system, which is associated with the temporal lobe? No, it's not. It is associated with the mesolimbic and is associated with the supracortex. All of the hemisphere that covers our brain. And the connection between these two manifested as a mind. And mind usually works with the experience. The level of the experience you do have a more mature mind.
Okay, and is there any associate between brain, mind, and relationship?
Absolutely, yes.
How?
Very, very smart question, actually.
Thank you. I have a good teacher.
When we do have a relationship, what does it mean about the relationship? What comes to your mind? Relationship is about the connection. Means that we do have the exchange. Exchange of what? I was talking about the electrical charges and then chemical charges, and I was talking about the flow and modifying and monitoring all of this flow. And when I'm talking to you, which is a kind of relationship, is a kind of communication. I'm exchanging the information. I'm exchanging all of the waves, electrical waves and chemical waves. If I just say a word that Liberty Statue, it's just one word, but your mind will be able to understand the physical location of the Liberty Statue, the shape of the Liberty Statue, or maybe the crowded people around the Liberty Statue having fun on a beautiful day. So with the little inputs and information that I gave you, your brain does have the capability to bring with the huge and humongous information. So it means that this is very important. It means that when we gave a little bit of the information, our brain are trying to make it generalized, bigger, and have a better, perspective about the information that we receive.
So, and I'm a little confused. I want to know more about this. How it works?
Okay, so let me get back to a little bit, previous that one. Probably you were a little boy and you were fascinated by your first bicycle that your caregiver bought for you, and you learn at that age that how you are capable to have a bike ride. if you believe that you learn how to have a bike ride at the age 5, 6, 7, and then you discontinue using your bike, and then you get back to age 25, 27, and you want to start it again, that experiences, your brain has the capacity to store all of the information in one part, and then at the time that you need it, it will bring it up, this information, and try to manifest it as a type of the behavior. So when we are talking about the relationship, means that we are exchanging all of the data that's stored in our brain, in our cells, comes to our behavior. We do have the same manifestation with our relationship with another person. If you say something to me, I can bring it up, all of the information which is associated with one word or just one non-clue communication, and then I can exchange all of this information to you. This is not my word, actually. This is comes from the Daniel Siegel, the psychiatrist. And Daniel Siegel was trying to let us know that, with each experience that we do have from life, we do have stored information. Just imagine that you are playing piano. When you are playing piano, there is a storage information. And actually, when you are playing piano, there is a storage information. But your brain doesn't make a difference between the imagination and actual act. So this is really helpful for all of the people that wants to do the meditation. If you are, feeling that, okay, I'm walking around the beach, beautiful, nice day, and I'm listening to the good music, very relaxing, exactly your brain change the structure and inform all of the information and store all of this information, look like that you are really, really in the beach that beautiful day.
Right. Yeah, exactly. It's happened to me. I was, playing tennis, and after 20, 25 years, my friends, they asked me, okay, do you want to play tennis? I said, oh, I don't know. I remember or not. But after a few minutes, looks like I'm doing every day, Yeah, exactly. You're right. You're right. So, but last time you mentioned about something, I have a note here, mood regulation. What is that?
That's very important, actually. When we are saying that, our brain does have the regulation means that monitoring and modifying. Monitoring means that, how much impulses is coming to me, and modifying means that how can I, decrease or increase the level of the stimulus is coming towards me. If you are in a danger area and you are freezed because of the danger that is in front of you, your brain is able to regulate, to monitor and to modify the level of the action that you have to, perform at that moment. You are running and you are fast running and no one can catch you, because at that moment, your brain is telling you that this is the time to use your maximum effort, maximum potential in your, muscles to run from that situation.
To flight.
So basically, yeah. Just imagine that you are in the middle of the jungle and you see a big bear. So that's why you are just running and running, and you can't imagine that, how much you can be fast at that moment. Because what? Because the body, the brain is telling you that, this is the time that we have to have the maximum and maximum effect, maximum speed at that moment for you. And another way that, if I want to explain it to you, that when you do have the disagreement with someone, sometimes you're just saying that, okay, we do have this disagreement, but sometimes you get so angry and you are trying to, show a reaction to that person, but you are holding yourself. You're saying, no, this is not a good, place. I have to hold myself. That type of, behavior is about the regulation, monitoring, and we call it as a mood and affect regulation, which is very essential, especially in borderline personality disorder. This group of the people are unable to, do the mood regulation. And with the DBT, we are trying to teach them that how they can modify, monitor their feeling and their behavior.
Okay. You mentioned about DBT, right?
Yes.
Okay,
D as a David, B as a boy, and T as a Tom.
Okay. It's gonna be development. What is that?
Dialectical
Dialectical.
behavior therapy. Yes.
Okay, thank you. I want this
No.
answer. Okay, so, and this is the same hat. They put the hat. That's the same thing. And doing map. That's
actually,
another story. Okay, so
Yes.
we are going there later probably. So, and now you're trying to explain how our brain capable to do mood regulation, right? And then
Absolutely.
after this, so. I heard one time from a doctor about coding and uncoding. What is that?
Yes. Yes. And very nice. That's a very beautiful aspect of the, psychiatry and psychology, since that, when we do have the traumatized patient, just imagine that, one child experiencing sexual assault, rape, anything that, as a bad, negative
Any
influence.
trauma, any trauma.
Any
Is it
trauma,
just
any trauma.
it's not just a child, or maybe it's happened when they was in the.
No, it's not
No?
like that. But as you know that when you are a little bit, younger, the trauma does have much more influence on you, because
Okay.
your resiliency is not that much mature. That's the minimum resiliency that you do have it as a child. But as you grow up, your resiliency grow up with you, and you are
Right.
capable to have a reaction, appropriate reaction towards the problem that you are facing at that time. So you were saying that what we are doing with the any traumatized patient, we trying to let them know that because our cells, neurons are wired in that way that any physical activity or any imaginary activity cause the changes in our brain structure. We are trying to put some hat on the head and give them the imaginary views, the positive influence and positive effect, and trying to uncode whatever happened in the past. So if I want to tell you that all the negative effect in the past is the code, we are trying to substitute it with the positive effect or positive memories or positive experiences, which we call it as a uncoding.
Okay, and do you mean you're like a reprogramming, or is not going? You cannot delete all data, right? You just okay. So
You're very smart. You're saying that exact question
okay,
that
my
comes
because
to
my first master's computer. That's why I'm just connecting between all things with computer. I know it's not like that, because over there we delete the data, but now you're not delete the data. You're just what you do,
we are trying to
uncoding,
fade it.
fade
Yes,
it.
we are trying to fading the the data.
Right,
As much as you do a little bit more and more, you fade the data, the negative data more and more. And by putting all of this storage as a positive storage, you are trying to just reaccommodate the information that already stored. And this is a big revolution in the treatment of the traumatized patient, especially in the unhealthy relationship.
What's the name of that hat?
We call it as a imaginary hat that we
Imaginary
put it
hat.
on.
Okay. When you put the
Yes.
imaginary hat on the head, you can get the map of brain, right, and see what's going on, and you can find out any trauma, anything in the past from childhood, and then you have a specialist to read the map, right? What's going on here, right?
Not really as accurate as you said. This is a kind of fiction stories.
Okay,
But
because
I
you
think
said
it
the
was like
imaginary hat, I thought maybe you're going to like a MRI of brain. This is your map of your brain, and then in this time, okay, you were 2 years old. These things happen. This thing is it like that or no?
No, but if we make a PET scan from all of the patients that learn how to play piano, we see a lot of common feature in their PET scan. if we get a lot of PET scan from a group of the population that they experience, I don't know, maybe listening to the meditation or listening to the positive music, we do have the different type of the PET scan, which they do have the common manifestation. So it means that when we experience something, our brain does have the same structure in physical appearance. So that's why all of the physicians think, majority of them think about one way, and it's very difficult to have the different type of point of views, because your brain trained that way. In a military service, your brain trained in a way, or a police officer does have same train that probably I didn't have ever. So that's why we do have the different point of view. We do have the different translation. We do have the different regulation about the data that we get it from the outside.
You mentioned about training our brain, and this train, you using same hat for that train? No. Okay, I want to just make sure what's going on here. And then you're using that hat to find out about all trauma, right? And then you said uncoding, right? And coding again. It's mean, what was the word?
Well, let me explain it a little bit.
How it works? How you send in signal and what's going on?
Yes.
Okay.
Yes, you are sending audio and video signals. You are sending audio and video signals to different parts of the brain. Your audio system is in temporal lobe. Your video system is on occipital lobe, and your PFC or prefrontal lobe is regulating this information. And this is the fascinating data that we do have the different parts of the brain doing the regulation of the different data that we get it from the environment. So yes, based on giving the different information to the brain, we are trying to uncoding. But it's not like that. By putting a hat on a patient or a person, we will find out what part of the brain has been damaged or traumatized. No, it's not going to be like that. We'll get the history from the patient. We do a lot of psychotherapy, and then we do have some intervention to decrease or modify the level of the damage.
Okay, amazing. So, and now how you want to connect all these stories with the relationship?
Okay, very nice. Yes, yeah.
Because you
That's
mentioned
nice
about
point.
something, we just go to brain, mind, and coding, uncoding, reprogramming, and now how you want to connect that story to healthy relationship or unhealthy relationship.
Let me explain it this way, that when we do have a fetus comes from out of a uterus from a mother, this fetus does have 270 days in the uterus and does have almost 600, 700 outside of the uterus as a first 2 years of the life. And accumulation of all these days is almost 1,000 days. Will show us that brain is functioning as a genetic and experience. So genetic is the blueprint, which means that happening during the infancy, when the infant comes out of the uterus. And we do have the 2 years in front of us to have more experiences with whom? With the primary caregiver, which is usually the mother, and mother with the verbal communication, facial gesture, sending the eye contact and touching or bonding with the baby and the mother. Attachment will be shaped at that moment. So based on that attachment, our neurons are able to store all of this information. And at the time that you are dealing with someone else, you are trying to start your relationship with someone else, you are using that blueprint of your primary caregiver and yourself to the someone is outside of this environment. So I believe that John Bowlby 50 years ago was talking about the attachment, And then, Alan Shore in 2012, 2014 was talking about the modern type of the attachment. And now we will understand that, we are just repeating our previous attachment or previous behavior to the next one that, we are seeing in a relationship. And if we understand that, our brain does have the different functionality with the different cells, and we are capable to modify and change this information, we can change our behavior, and we can change the type of the relationship that we do have with the other person.
So, and as we know, we have two types of attachment: secure and unsecure attachment. So, and this story and that type of people, they have a unsecure attachment in the relationship.
Unsecure attachment comes from the anxious mom, with a depressed mom. When the mom is so depressed that unable to provide enough facial expression, enough level of the care to the infant. The infant doesn't understand that what type of the word she or he is dealing with that. So there is a lot of confusion, and there is a lot of unknown and question mark in front of that infant, so cause a lot of anxiety. And anxiety is the core for everything. So when the anxiety started, the next level is depression, and next level is a little bit more deeper. So if we are able to prevent anxiety or decrease the level of the anxiety in our children, it's at the beginning, it's prevention, and it's a type of primary type of the treatment and prevention that we are working with our children.
Okay, and you mentioned about something, and I have a question about. So someone has a secure attachment problem, and then how you can help them. Is it possible to encode, and reprogram again?
Yes. Yes.
How?
Absolutely. Yes. Well, first of all, we have to understand that what is the problem. We have to have enough the insight that what is the cause of all of this happening to me. I believe that I had a patient that comes to me and said that all of my girlfriend are borderline personality disorder. I had 5 years ago a relationship with a young lady which she comes with the borderline personality disorder, and then 2 years ago, and then now I'm dealing with another. So it means that there is a pattern to catching and to receiving. It means that we do have the same pattern to processing and interpreting the event. So it means that if I can change the data in my brain, if I can change the information in my brain cell, as I was mentioning to you, I can switch from one behavior to another behavior. If I am dealing with the unsecure attachment, if I'm dealing with the type of attachment that I always feel empty, I feel anxious, I feel nervous, I'm confused, and I don't know what should I do in the relationship, I can get back to the therapy. I can talk to someone in mental health professional and ask them that is there anything that I can work on it for changing and modifying the data as a negative data that I have in my cells. So yes, they do have the focus trauma center. They do have the imaginary focus information, and they do have the emotional focus therapy. That all of them will help the people to code and uncode the negative experiences.
So obviously, when people going to clinical psychologists, they can help them. If they are specialists in EMDR, they can help them with that way. But I'm talking about a neuroscientist or a psychiatrist like you. You helping in the different way, right? You are not doing EMDR for that, because you mentioned about that hat, and that's another way. That's another technique.
This is, when we are talking about the psychiatry is not just the individual branch of the science. We are
Right.
working as a team with the neurologists, with the clinical psychologists, with the pediatricians, with the general physicians or internists. So it's a kind of the team, and we do have the global aspect about what's going on in a patient or in a person. I believe that when we are trying to uncode the negative aspect of the information that we do have, we need the good experience substitute to the negative experiences. But it's not the only thing that we have to do it. We need constant information. Good information goes and sink in the brain. So one time saying it's not going to work for us. If I read a article for you and I give you a couple of information, and you will get fascinated and say, wow, interesting. Only 7% of this information will sink in your brain by saying once or reading this article once to you. But if I do, practice and practice, repeat and repeat, you will get more sinkage of this information on your, brain cells. So that's why for everything, to get the skills, to get the mastery, we need the practice. Have you ever, think about that, how a gymnast can, do a great performance that we cannot even do, do one action of that because of the practice and practice.
Practice. Okay.
Yes, and when you practice, it goes to myelin. Myelin is a kind of, a sheet that, cover all of the neuron cells and will store over there and help us to use that manifestation at the time when we need it quickly. It means that, I shouldn't think about that, okay, this is a negative situation, what should I do? It comes genuinely outside of me, like, singing a song, very, genuine simultaneously, without effort and without the energy, because of the practice that we had it at the previous time.
So I have a question now. Do you mean with practice I can learn something? Of course I can. But with imagine to practice, I heard something, I don't know if it's correct or not. Please correct me. I heard if you're thinking and focus with your brain with something, you can learn. Is it possible?
It is, theoretic wise, yes, it is possible.
How?
If we look at you how to dance, for example, I will show you that
That's
you should
different.
Use your
If I look at something, yes, but if I'm thinking to playing piano.
Well, first of all, we have to show you, and then you imagine. If you want, you have
first
to
I need to see, obviously,
yes,
and then
yes.
I have to imagine
And
I'm
then you have
playing
to
like
imagine.
a someone.
Yes.
Okay, so it's happened to me about doing something for first time, and I said this is my first time. I don't know. It was playing pool, and I said this is my first time, but after 30 minutes they said, no, you're joking. It's not your first time. Or when first time I danced, Spanish dance. It was a very professional location. Everybody super professional dancer. I was just watching them, and then it was after party, and everybody coming, mingling, and I start dancing, and I told my friend this is my first time, so I was just watching. So this is I can feel it. It's related to me. Or when I was
so you had the experience.
I was teenager. I just watched one time any show, and my mom said, okay, design it on the paper, the dress. I was like a 14, 15, and watching a TV show, fashion show, and when they finish, I just draw it on the paper and give it to my mom, and so so that's different. But when you said imagine something and learn that one, is a little hard to understand for me. How is possible?
Because we are not in, we don't have that much information about the wiring of the brain. So,
Okay, give us a
I hope
information,
that,
please.
no, actually, I'm saying that, based on our information at this
Oh.
level, we do have that much information that,
Okay.
this is going to happen. But I'm sure that, next 50 years, later from now on, they will understand and they will explain it very well. And, the people at that moment, they will get and absorb the why and how is happening.
Amazing, amazing. So, and now, just imagine, same your example. You said you had a patient. He said every time I met someone, they have the same pattern, same personality, and he repeating same pattern and same story. How you can fix? You mentioned one time, but I want to just make it clear and make sure we can fix it and move on with that problem. How we can fix it?
First of all, I want to just a little of the correction about the words. We are not fixing. There is nothing as a fixation.
Mm-hmm.
So,
Correct.
I want to tell you that, there is no fixation, but we are trying to make an improvement. To make a better, quality of the life for the person that, is seeking for the, need and help. So I believe that, yes, by, practicing with, experiencing good experiences and good positive effect that, is our surrounding, we can substitute the negative, aspect of the information with the positive information and bring a healthy life to the individuals.
Amazing. In this case, improvement is possible, change is possible. If I want to, improve on myself, if I want to change on myself, and there is lots of help with professional specialist, clinical psychologist, neuroscientists, and also do you have any center to help people, or people, if they have a question, how they can help your service?
I believe that any population does have the access to the Medicare, Medi-Cal, and different type of the insurance they do have, that they can access to the needs with the minimum cost, actually, because if you're going to start at the treatment and coming there to see a mental health professional, you need it for a minimum for a long period of time, 12 session to 16 session, and 12 to 16 session is not going to be cheap for everyone. So it's better to follow up with their insurance and find out where and when they can get the services with the minimum, with the minimum cost.
So let me see. I believe we cover most of the thing, and we are going to continue. We are going to continue with the same topic, healthy and unhealthy relationship, next week with Dr. Mitra Khorramshahdhi, and Evolving Mind every Tuesday at 4 p.m. Right?
Absolutely.
Thank you
Glad
so much.
to be there.
Thank you for your time. I appreciate it. And stay tuned for next program. Thank you.